The Developing Well Child, Part 2. This lists some of the normal vital signs for an infant at newborn and up to 1 year. Normal toddler vital signs. Normal vital signs of the school-age child. And normal adolescent vital signs. Repetitive exposure to organisms can help a child develop immunity. Every child is going to respond to illness a little bit differently. The family definition by the American Academy of Family Physicians is the family is a group of individuals with a continuing legal, genetic, and/or emotional relationship. Society relies on the family group to provide for the economic and protective needs of individuals, especially children and the elderly. The society's definition of family is a group of people living together or in close contact who take care of one another and provide guidance for their dependent members. The nuclear structure of family is composed of a man, a woman, and their children. They can be biological, adopted, foster, his or hers. They share a common household that is not necessarily married, and there's no other residence. The blended structure has a custodial parent and children with a new spouse. Both spouses might have children from a previous relationship. At least one step-parent or sibling and/or half is part of this group. A step-parent is a biological parent's new spouse. The extended structure contains at least one parent and 1+ members other than the parent or sibling. It can include numerous combos of others. Most often, though, it's grandparents or head of household with primary responsibility or raising kids. The single-parent structure is generally headed by women, but it is becoming increasingly common for dads also. It's usually a result of divorce, death, desertion, or illegitimacy. It can also include adoption. Society is more accepting of this type of family these days. The foster parent is the parent who cares for children that require parenting due to a dysfunctional family, no family, or individual problems of the child. Binuclear or joint custody is cooperative parenting arrangements. There's joint responsibilities with a terminated spousal unit. Polygamy is multiple spouses. It's considered illegal in the United States, and it's practiced by some small groups. It's usually based on religious beliefs. It can be a high status in other countries, but it's usually limited to rulers. It may or may not have separate households for subunits. Communal structure shares household duties, child rearing, finances, tasks. It's a variation of the extended family. Members will share responsibilities, and there's a strong reliance on group members. It's usually formed due to dissatisfaction with social systems. There may be divergent beliefs, practices, or organization, and it can be tied to religious beliefs. There is a number of communes that are decreasing, or the number of communes is decreasing. Gay or cohabitation are two persons of the same sex that live together. They're bound formally or informally, with or without children, and these families do face complex issues. Some studies show that children are not harmed by membership in a gay family, but some of these children may face identifiable social concerns. Qualities of a strong family. The family APGAR is used to assess family function and enables the nurse to develop interventions that aid the family to achieve a healthier adaptation to the child's health needs. Adaptation is how the family helps or shares resources. Partnership are lines of communication and partnership in the family. Growth is how the responsibilities for growth and development of the child are shared. Affection can be overt and covert emotional interactions among family members. And resolve, how time, money, and space are allocated to prevent and solve problems. Family is part of the community. Assessment of the community is important in creating discharge plans for the family. So in other words, what does the community have available that will assist or help with the discharge planning? Different factors to consider would be housing, access to public transportation, city services, safety, and healthcare delivery system. In the community, we also see the homeless family. This has had an impact on the growth and development of children. A support system and financial resources are often lacking. School or emergency department nurses may be the only contact with health care, or may be the first to identify the status of the family. Community referrals for food, housing, education, and financial assistance are essential. Attachment is human physical contact to infants, and it is essential. There were some studies following World War II in which Adolf Hitler directed a study in which children did not have any contact or had limited contact except when it was absolutely necessary. And it was found that there were higher death rates in these children that were rarely held or talked to. A good relationship with a parent figure is fundamental to a healthy personality. A child's attachment with a parent figure can affect a child's development, such as when they learn to read, or they're toilet trained, or they walk, or they write, etc. The better the attachment, the more on task or even possibly ahead of developmental schedule the child might be. The less attachment, the more at risk for falling behind the child may be. 4 phases during infancy has to do from birth to 4 weeks. The infant will respond to anyone. At 8 to 12 weeks, they cry, smile, and vocalize more to the mother, but they do continue to respond to anyone. At approximately 6 months, they begin to show distinct preferences for the mother or primary caregiver. They follow, cry when she leaves, and they feel most secure with that caregiver. And approximately 1 month following attachment to mom, they begin attaching to other family members. Bonding and attachment is based on a mutual relationship between the parent and the infant. We look at infant behavior, maternal attachment, and parental engrossment. There is a maternal sensitive period immediately and for a short time after birth. This is enhanced by the face-to-face position, skin-to-skin, or eye-to-eye. Parental engrossment is the process of forming a sense of absorption, preoccupation, and interest in the infant. Visual awareness, the parent focuses on the beauty of the child. With tactile awareness, they're always wanting to touch or hold the child. Awareness of characteristics. They look at the emphasis of this characteristic is like the father or like the mother, etc. Elation, increased self-esteem and satisfaction. This is greatest during the early contact, and it intensifies with the infant's responses. It's very important that you assess bonding in the family unit. You need to get to know infant behaviors. And you do this through stroking, talking, learning, and identifying with the infant. Reciprocity is the mother-infant responses that usually start by about 2 to 3 weeks. Signs of recognition such as sucking, cooing, reaching, grasping. Steps for bonding include orientation, acceleration, deceleration, and turning away. Different behaviors that indicate emotional bond would be the mother reaching for the infant, the in-face position, or it's ENFACE, touching and undressing the infant, holding, rocking, cradling the infant close to the body, referring to the baby by name, reacting to the fussiness, comforting when the infant cries, noting reports of depression, dissatisfaction with the infant, and a continually crying infant. Fear disrupts a child's level of trust. It threatens self-esteem, and it might require a restriction of activity. Stranger fear becomes prominent at ages 6 to 8 months. It's related to the infant's ability to distinguish between familiar and unfamiliar faces, and these behaviors include clinging, crying, or turning away from strangers. Interventions and care suggestions vary according to developmental age and situation. Strangers include nurses, daycare providers, physicians, teachers. You need to allow the infant time to warm up and allow safe experiences with strangers. Hold the child close to the parent while they observe the stranger and acknowledge that clinging dependent behavior is normal. Provide reassurances that the parent is present. Gaming or playing with the infants can sometimes help with this, such as talking on a phone or providing a favorite toy. Different interventions for fear with the infant would be to talk to the parent first. Again, talk softly and avoid sudden movements. Meet the infant at eye level and maintain a safe distance. Avoid sudden intrusive gestures. With toddlers and preschoolers, they have a variety of fears that can be real or imagined, such as fear of the dark, being alone, or bedtime. It can be animals, objects, or people. They usually relinquish their fears by about 5 to 6 years of age, and they can associate a certain person with pain. Parents can become frustrated when logic doesn't work, and these children can also have fear of attire, such as scrubs that a nurse wears or white lab coats. They overcome their fears through practical methods, such as night lights, desensitization, such as a progressive contact with something that they fear, such as a dog. So they would observe that dog or observe others interact with the dog, etc., while they're still close to the parent. Sometimes these fears don't subside and they can become disruptive to family life, and in these instances, professional help may be required. The school-age child is faced with more stresses than previous generations. There might be conflict in their home, more divorced families or separated families. They see violence everywhere: media, TV, radio, newspaper. Conversations of adults can be overheard by the child. They learn to distinguish which strangers are not safe. Mobile family without long-term relationships. There's now violence in the school, or pressure to do good in school, pressure to have a boyfriend or a girlfriend. There's in-class labeling by peers. They have fears of being hurt, of school, being kidnapped, having surgery, fear of the dark, social withdrawal, self-consciousness, death, and family. To help a child cope with the stresses, you need to recognize the symptoms of stress and fear. These can be stomach pain, headaches, sleep problems, tachycardia, bedwetting, change in appetite, withdrawal, regression. And you also need to assist a child to cope with new situations by introducing them to others, teaching them deep breathing and relaxation techniques, encouraging physical activity, physically staying with the child. Don't ignore their fears, and understand that they may need further assessment or referral. Play is considered to be the work of children. It has a purpose. They learn how to relate to situations, how to adapt to the demands of society, how to communicate, and how to have relationships with other people. The nurse should encourage optimal play activities that are age appropriate. Social affective play is where play begins. With infants, it will include adults touching them, talking to them, nuzzling them, and their responses. And the type and intensity of this varies from culture to culture. Since pleasure play is non-social stimulating, where objects in the environment will attract the child's attention. They are stimulated by handling raw materials such as water or sand, body motion, and other senses such as smelling and humming. Sensory tables can hold raw materials for the children to play with, and they're frequently placed in preschools because of the stimulation that it provides the child to learn. Skill play is after the infant develops the ability to grasp and manipulate objects and can play with toys. They begin to demonstrate and exercise new skills, but they can become very frustrated if they fail. An example is getting on a play motorcycle or a tricycle. An occupied play is where children daydream. They fiddle with their clothes or they actively observe others' behavior. They may focus their attention momentarily on anything. Dramatic or pretend play is predominant in preschoolers, such as rocking a doll or dressing up, etc. It is vital to the development of children. Playing house or school with dolls or other children is dependent on the child's age. Games that imitate are where the child imitates others playing with the child, such as pat a cake or peekaboo. Formal self-sustaining games such as London Bridge, Ring Around the Rosie are included, in addition to competitive games such as board games or sports that are more for the school-age child. Sensory motor activity is a major component of play for all ages. The predominant form is in infancy. It allows the child to be active and explore the nature of their world. Play becomes more purposeful as the child ages, and it's essential for muscle development. Intellectual development is how children learn colors, shapes, sizes, textures, and the importance of objects by exploration and manipulation during play. Examples of such play would be puzzles, books, or sensory tables. Socialization is learned through play with other children. Again, children learn to interact with others through play. They learn how to establish relationships, how to problem solve, and about give and take. Creativity can be done as a solitary activity or as a group, as this oftentimes enhances one's creative abilities. Dress up is an example. You transfer interest to the outside world, and they experiment by trying. Self-awareness is developed through play as the child becomes more aware of what they can and cannot do with the help of the parent. It compares their abilities to the abilities of others.